Hi, it's me, Pat Stewart again, up in the attic. And I'm wearing my scrubs because we're going to talk about medicine, first aid, and getting ready for babies. Okay? So, what's involved? Hi, it's Pat Garland Stewart again, up here in the attic. And I'm wearing my scrubs because I want us to talk today about medical care, first aid, and preparations for breeding. Okay? So, where do we get started? Well, we have to look at the first assumptions that we make, which is the animals are being fed well, they've got good hay, they've got fresh water, they've got access to minerals. If any of those things, and they've got a good shelter. If any of those things are not true, then you're looking at a whole different set of troubles than we're going to talk about now. Before you can actually worry about fixing the issues with your goats as far as immediate needs, it's for they're not feeling well, you need to make sure that you're taking good care of them. So, assuming that all that is true, then we're going to go on from there. Things that you should have on hand include apple cider vinegar, preferably raw. You can make your own if you can get a hold of some old cider and a mother. That's the actual agent which turns it from a inactive vinegar to a living thing. You can buy raw vinegar at the grocery store. I'm always tempted to make myself just because I would like to have more available than I usually do. Okay. Baking soda, that's a good preventative for dealing with bloat and other stomach issues. And kelp, which we've talked about before. But kelp is a wonderful way to get those chelated minerals and natural minerals and trace treatments into natural trace minerals into your goats. Okay? Now, those are things to just regularly have on hand. Then what else you deal with on a regular basis? Worming. Now, when I say regular basis, I do not encourage worming on a schedule. What that does is it tells the worms what schedule they need to live on. And we're having a real problem in this country with worms becoming immune to the treatments that we have. So, I'm going to go through some basic wormers, and I want to start by saying what are the signs that an animal needs to be wormed. If you can get a hold of a class on FAMACHA, FAMACHA, and a translation card for FAMACHA, then that's a great way to know when you need to do it. FAMACHA has to do with the mucous membranes in the eyelid and being able to look at those and rate by color how bad an anemia problem you have, anemia primarily caused by the worms. So if you can do FAMACHA, then you have a really good judging system for infection. If not, learn it. The basics are that the whiter the mucous membranes on the inside of the eyelids, the more anemic the animals are. Then, learn how to do fecals. And I'm not going to do that here, but if you can find an old magnifying glass, some stains, some fluid that's used for actually taking the stool sample and making it into something you can see with the microscope, and a good reference as to what type of worms you're looking at, you can judge for yourself what kind of worm load you're looking at. You may see worms in the stool, but more than likely you're going to be finding eggs and infant worms in the magnifying glass. If you don't have access to either one of those things, some really good simple things is to look at clumpy manure. Clumpy manure usually means in a food situation that they've got too much protein, too much sugar. But it may also mean that they're wormy. If they're eating a lot and they're not gaining weight, worms is probably your first thought. If they've been under a lot of stress, treat for worms. What might be stress? Bucks that are not around females that are not being used. So they're in rut. They're really hyper with their hormones. They're fighting each other, but they have no release. Animals that have been either transferred from one home to another or have recently attended a show. Changes in temperature, really hot or really cold, quick changes, those can all cause stresses. Too many animals in an enclosure is another stress situation. Weaning or kidding are other situations that might kick off a worm load. Why are those stressful situations opportunities for worms to explode? Because the animal's natural defenses are down at that point. They're tired, their whole system is stressed out by the whatever has happened in their lives, and so they're at risk of succumbing to an illness or to worms. Worms are advantageous. They take advantage of whatever they can get. So if the animal is depressed for some reason, under stress for some reason, then the worms are going to take off and have a wonderful explosion of population. Using copper, making sure copper levels are up, will help control worms. Studies are still underway as to how much copper can be toxic to the goat, but without and toxic to the worms without doing damage to the goats. Okay? So, what type of wormers can you use? Many of us try to stay away from using chemical wormers. I've tried using some of the herbals. Some people swear by them. From my experience, they are great at controlling a worm load, keeping things down under control where they're not really a damage to the animal. But if you've got a full-blown worm outbreak, then you need to look at some chemical wormers. You might be looking at roundworms, ascarids, or strongyloides. You might be looking at tapeworms. You might be looking at whipworms or hookworms. Lots of different things. Each one of them has a different set of wormers that they respond to. One of the most common wormers that I have used in the past, which is becoming ineffective in many parts of the country, is fenbenzidole. It comes under the trade names of Panacur or Safeguard or fenbenzidole. It's got a fairly quick milk withdrawal rate, meaning you can't drink the milk during that time. The babies can, but you can't. That's got about a 10-day withdrawal date. 1 week I've heard to 10 days. I go to 10 days. Another one is ivermectin, which could be Ivomec. Could be under the name ivermectin. Could be under the name Zymectrin. That can either be a paste, like Safeguard, or it can be a liquid injectable, which can also be given orally. Both of these address different worm loads, so you need to take a look at what kind of worms you're dealing with. If you've got a lungworm infestation, ivermectin won't touch it from my experience, but if you can get Safeguard to work, that will. Now, if you're lucky enough to live in the places where these drugs are still effective, the worms are getting adjusted to them. So both of those are primarily horsewormers. Because goats have 4 stomach chambers, and those are formulated for horses that have a monogastric system. Being able to get the medicine effectively through all 4 stomach chambers into the intestines means we're going to have to triple the dose and do it 3 days in a row. Or in the case of ivermectin, you can triple the dose and do it 2 days in a row. The 3rd day won't hurt anything. You should then repeat it 3 weeks later, because those drugs do not address killing the eggs, and they will kill off the adults, they will kill off the immatures, but the eggs will hatch and have a new infestation. So if you kill off the adults, but you don't kill off the eggs, then in a couple weeks you're going to have those eggs hatch and you're going to have a new infestation. So do it once and then do it again 3 weeks later. Okay? There are types of wormers which are paste wormers, as I mentioned, that you can just squeeze into their mouths. There are oral wormers, which you can just put it in their mouth. You don't need a needle. There are injectables, and then there are porons. Um, there are the porons that include Eprinex, which is a poron ivermectin, or Cydectin, which is, I believe, a poron Morintel. It may be a poron Pyrantel. Excuse me, I think it's a poron moxidectin. The problem with using any wormer during breeding season or when an animal is pregnant is anytime you are giving a chemical change to a doe's body or a buck's body, you risk genetic changes to their zygotes, to their sperm and their ovum. So I try not to use any wormers on a doe that I'm going to be breeding within 2 weeks of when I choose to breed her. I try to treat my bucks for worms before breeding season starts, because after breeding season starts, and realistically, they're in rut more than half the year, it can be difficult to judge that time. But there are times when you know a certain buck is going to be used. Give him about 3 weeks to recover, because the semen, you don't want to damage the sperm, okay? Sometimes I have seen, and other people have seen, that if they give antibiotics or they worm an animal and then actively use that animal for breeding, they're more likely to see extra teats. And if it figures if it affects extra teats, it might actually affect intersexes, or create intersexes. So try to avoid those things. If you're using an herbal wormer, it will tell you right off the bat, do not use a wormwood herbal wormer on a pregnant doe. Wormwood will cause an abortion. Okay? So in the case of Molly's Herbal, she has 2 different types of herbal. She has one that she recommends using once every couple months, and one that she encourages using once a week. The one that's every couple months contains wormwood, and she'll tell you right there in the directions. You do not want to induce an abortion just because you're trying to get rid of the worms, right? Now, you can use the porons like Aprinex and Cydectin. You can use them either as a poron or as an oral. In both cases, they supposedly have a 0 milk withdrawal. I always give it 24 hours, just in case. Those are passed through cell membranes, not directly into the bloodstream. So they're not supposed to get into the mammary system. But you have to be careful. Those are actually medications which will also take care of lice and mites, which we often see in situations where the animals have been in confinement for a long time, like the winter. Lice and mites become a problem when we come into springtime. They live just endemic to the area, and they're looking for a heat source, they're looking for a food source. And so in the late winter, early spring, we often hear about louse infections. You can use Sevin dust if you want to use an old-fashioned agricultural thing. You can use diatomaceous earth, but it's not as reliable because you'd have to do it all the time. Or you can use Eprinex or Cydectin. I've used Eprinex. I've personally not used Cydectin. Now, once you're giving the wormer, remember you're going to have to repeat it, or you should monitor it. If you're using an oral, you're still going to have to repeat it in about a month because of the life cycle of the worm. All right? So that's your basic care of what you need to figure out, how much you're going to need to take care of them. Hoof trimming is certainly involved in this. If you've got scurs, watching the scurs to make sure that they don't grow back into the skull. You want to trim those back. But other than that, goats are pretty easy to take care of. as long as they're given the basic essentials for life. But sometimes an animal gets into something, and sometimes something goes wrong. So, how do you know when you're dealing with an animal that's off? If you spend a lot of time in your barn, you'll know what's normal behavior. If you've got an animal who's really friendly, like my Rachel Carson, who's in your face, if Rachel doesn't come to see me, something's wrong. Now, I don't worry. I don't worry if Rachel doesn't come to see me two visits in a row. But if 2 days in a row goes by and I don't have Rachel Carson in my face, then something's up with Rachel. She's just that friendly. She'll leave food to come and get love. So behavior is a good indicator. But what other behaviors should you be looking for? Goats grinding their teeth is definitely a sign of pain and stress, but primarily pain. So that's something, if you hear tooth grinding, watch that animal. If they're tooth grinding and they're not eating, then they may have a problem with their teeth. We don't have goat dentists. If a goat has a problem with a tooth, it's usually you call the vet and they'll just come yank it out. If they're head pressing against the wall, and this could happen with dogs and cats too, that's a sign of a possible aneurysm, a pressure building up in their brain. You need to keep that animal quiet and call the vet. There's not much you can do for an aneurysm other than just be aware that the animal's under pain and manage for that. If you see them standing in a corner and their fur is all sticking out at the ends, kind of like a porcupine, and they're all tucked up, they're in stomach pain. They've got a bellyache. It's probably in their rumen. It's probably not in the other 3 chambers. So you want to treat with Pepto-Bismol and manage for pain. If they're normally very social with the rest of the herd, but all of a sudden one's off on their own, watch that animal. They may have something wrong. It may pass on their own. Goats will self-medicate. They will treat their own problems as much as they can. But you should watch it. And if you see a male who's straining to urinate, his legs are stretched out and no urine is coming, you need to treat for urinary calculi, which means call a vet and make sure he is heavily hydrated. He may need to have a surgery to recover from the urinary calculi, or you may be able to, maybe you got lucky and you can acidify his urine, increase his water intake, and flush things, but you need to talk to a vet. Okay? Now, I talked about pain management. How do you manage the pain for a goat? Aspirin. Good old-fashioned aspirin. Not Tylenol, not ibuprofen. You want simple, non-buffered aspirin. If you were to use a buffered aspirin, then you're actually introducing a buffer into the rumen, into the gut, and they need that active ingredient in the rumen. So you don't interrupt the rumen flora. You want to give regular aspirin, 1 or 2 for an adulto, depending upon the pain. Now, a natural alternative to that, if you happen to be in a place where you can find willow leaves, willow contains salicylic acid. Salicylic acid is aspirin. So rather than fight with a balling gun to try and get an aspirin down their gullet, rather than fight with the balling gun and trying to get an aspirin down their gullet, you can just give them some willow leaves and they'll eat them. They know that it will taste better and feel better. There are other medications you can give. It's a good idea to talk to your vet about having some Banamine on hand, but Banamine can only be used for a few days because it can cause problems with the kidneys for long-term use. However, sometimes you're looking at long-term use versus dying from pain. And goats can die from pain. I've seen it happen, especially males. I have often said that the only thing wimpier than a male goat is a male human. Sorry, guys. But a goat will just give up because they don't want to be in pain. So, Banamine, and then talk to your vet about other medications you might be able to use to keep the pain under control. Now, what kind of things are you likely to run into? For babies and for elderly animals, you may be running into coccidia. We'll talk more about that later on, but let's start it right now. All around us, as we all know, there are germs and there are parasites. And coccidia are one of those parasites that we all just learn to live with it. Goats just learn to live with them. Sheep will, everybody, all livestock deals with a coccidia. But they usually develop a balancing point where it doesn't bother them. If the animals are elderly or they're infants, they haven't developed that balancing point yet, and the coccidia will take over. So we need to kill that coccidia. Wormers will not do it. You do need a very strong antibiotic, usually a sulfa drug like dimethox. There used to be one called Sulmet, which is no longer available for goats. SMZTP is another one. Baycox. Talk to your vet and have on hand some coccidia treatment. I feed my dry stock a coccidiacide food. I do feed them a medicated feed because those animals are left not handled as much, and as babies or as bucks, they can be under a lot of stress and then may succumb to the coccidia. So I do feed them a coccidiastat or a coccidiacide in their feed. The other big thing you have to watch out for is bloat. You can think of bloat as a stomach ache gone amok. In a horse, bloat will cause colic, and colic causes a twisted intestine. With a goat, what happens is the flora in the rumen go wild and crazy, and they have a party and they create a whole bunch of gas. So much gas that they can no longer move things through the system. So what we need to do is find a way to stop the gas from being made and then increase the gas from being, increase its excretion from burping to farting, okay? Whatever it takes. If it's a really bad case, your vet may actually have to come in and put in a tool which is actually punctures the rumen, but try to avoid that as much as possible because you're dealing with all sorts of side effects from using those tools. But if you keep Pepto-Bismol around or mineral oil around, vegetable oil, those are all natural treatments. There's also actually another thing called no bloat, which I think is propylene glycol. But what we're doing is treating the inside of the gut, the rumen, to calm down and limit their access to gases so that the goat can then begin to get rid of it on its own. At that point, keep the goat moving, take it for a walk. Don't give it any more grain. Give it hay to eat when it feels like eating again. If bloat goes on too long, it can lead to polio. And polio is not the contagious polio. It is actually encephalopoliomyelitis, which is a brain inflammation, where the goat is no longer making its own thiamine, its own vitamin B. The brain needs that in order to function. If the brain cannot get that from its food, and you have to give it to them externally until the stomach can take up the slack and get back to work. Otherwise, all of the neurological systems in your goat are going to fall down. Okay? So heading off and avoiding bloat altogether is the best way to avoid polio. So how do you avoid bloat? Don't overfeed them. Don't give them too much sugar. Don't let them get in the grain room. Basically, it's sugars. Getting a hold of sugars. Just like we like sugar, the rumen flora loves sugar. And so do a goat's taste buds. So they get in, they eat too much grain, or some cases they get out of they eat too much fresh grass too soon, or they have like access to freshly budded sugar maple leaves. All those things really set off the gut to be very, very hyper and can lead to bloat that way. I'm not had it on my property. I have had to fend it off because I knew it was probably going to happen. And I did that by giving everybody some Pepto-Bismol that had gotten in the grain room. I keep my grains locked up in another room. I make sure that all of my buckets have tightly fitting lids, so if the goats do manage to break down the door, they still can't get in. I don't feed first cut hay that's wet. I don't feed haylage. Some people are starting to feed more haylage and silage. If you're feeding chaff hay, you have to be careful because they add molasses. Molasses is a sugar. So you have to be just careful with how much access to sugary foods that they get. Regular hay, they can eat all they want. Really sweet browse, that you have to be careful of. Okay? So what treatments do we need to have on hand? Well, you need to have some penicillin and some oxytetrin. Oxytetrin. You need to have penicillin and oxytetracycline, also called Oxytet. Penicillin comes in both long and short acting forms. I like the long acting form. It's one shot every 24 hours, as opposed to the shorter acting form things, which you usually have to give a shot a couple times a day. Talk to your vet about how often and how much to give. I'm not going to give you doses here. I also keep vitamin B around in case I have a polio issue. Bosi, which is a selenium or EC or selenium. There's selenium shots that I can give to make sure the goats are getting enough of their trace mineral selenium. And then Banamine. And if you've got Banamine for painkillers, for pain control. If you are dealing with a respiratory illness, the broad-based antibiotics such as penicillin and Oxytet may not be enough to address a respiratory thing, and you don't have time to waste. So there are medications that are specifically for respiratory infections, things like Naxal or Exenel, and which has now been replaced by Exceed. There is another medication called Nuflor. These are things you'll need to talk to your vet about. Get him or her to give you a prescription and have them on hand, or obtain them from her or him, or obtain them from your vet. In the case of milking does, one of the things we often see is an inflamed udder. And I'm going to talk a little bit more about this when we actually get around to milk handling, but I'm going to talk about it here now too. The udder actually contains all these little alveoli full of little tiny milk ducts. And the teat canal, which goes up the middle of the teat, has a sphincter muscle at the end, which can keep infection out. But that sphincter muscle is left open when we milk by hand. When a kid nurses, the saliva in that kid's mouth actually seals off and acts to protect that teat canal. But if we don't, since we're not doing that with our own saliva, we have to use a teat dip. That canal opening will be open for 10 minutes, and that's 10 minutes that the animal is open for infection. If you have a doe who likes to go back in the barn, into the barn and then lie down, definitely teat dip. If you don't know what the doe does, teat dip. Some people don't like to teat dip. I admit I don't like to do it, but I have seen somatic cell counts be lower, healthier animals by teat dipping. And I did have a doe that lost half an udder to gangrene because we were drying her off, we were tapering her off, and I did not dip her teats because it was at that time when we started drying her off 12 below zero. And then we live in New England, so we had a January thaw, and the next day it was 36 degrees. And she was lying down, her canals were open, and she got an infection. And because I was drying her off and I didn't milk her for another 2 days, by the time I found it, she had a raving mastitis infection. I called my regular vet, who tried very nicely to save me a trip and diagnose over the airwaves, over the telephone, suggested that I use the wrong medication. It wound up turning into a real mess, and the doe wound up with gangrene and losing half her udder. All because I didn't teat dip. All right? So having a teat dip around is really important. If you have an udder infection, a mastitis infection, talk to your vet. You'll need to have the milk cultured to know what kind of infection you're looking at. Avoid all that by teat dipping, okay? Sometimes you'll see little bumps on the outside of the udder. It'll be sore for the goat for you to touch it, and it may feel crusty. That is a staph infection. It can be contagious to humans. My experience is that it's because the doe is under stress. Oftentimes, if I'm sharing the milk with the babies, she'd rather be with the babies. So when she's not with the baby, she's worried about them. Her defenses are down. The staph can take root. So if I put her back with her babies, then we're fine. If she's dealing with a subclinical mastitis infection, she's probably not getting enough calcium in her diet. I can give her dolomite and vitamin C, as suggested by Pat Colby in her book, The Natural Goat Care. That will often help balance things out, and the staph will go away. You can treat the staph. It's very stubborn. What I found to be more helpful is to use a lavender tea tree spray, and as a part of my teat dip ritual, and making sure that I support the doe in other ways. There's another thing that I have actually found to be very helpful. I just spoke to my vet about this. It's not supposed to make sense, but it does work. And that's keeping colostrum around. Supposedly, kids can't take up antibodies after 24 hours. But I've seen some really amazing turnarounds in animals that were fed colostrum. The colostrum has antibodies. It is super concentrated nutrition. It is not going to really bother any stomachs. So if you've got a goat who's feeling off, you can give them some colostrum. I give my dogs colostrum pops. I have used a product called ID Blend, which is a concentrated cow colostrum. It was given to me as a sample, and I kind of said, oh, it's snake oil. It wound up being very helpful for goats under stress. So keeping that colostrum around and using that for an animal who's not feeling quite up to par can be a way to stave off a later problem or to support a system that's already under attack. Okay? So those are your basic things to have on hand when you're dealing with goats as far as medical care. And in the next class, we're going to go over breeding and getting ready for those kids. Okay? So see you then. Bye.